what is that process, and how many steps does that process have? And then how do we need to take care of it if we go through those, let's say surgery?
Okay. First, there's a misconception that the aging will start only once you're above 40, above 50 or whatever.
Okay.
Because Indians, unfortunately, right from 20s, the aging starts with the tear trough. So we have a very, the under eye circles, the dark circles, and the depression around the eye in the form of where the tears flow, that kind of a thing, a depression. That's called a tear trough, which happens right from 20 years of age. So unfortunately, we Indians tend to age with the tear trough initially. So even at 20, if you have a tear trough, if you don't correct that with a filler, then what happens is you'll have a very tired look. So even if you slept well and you're healthy, people would ask you, are you tired? Are you not feeling well? Or are there any problems at home? And they'll just get baffled by it. That why are they asking me that? Because I'm perfect and fine. Because of that tear trough. So if the fat is lost below the eye and there's a depression there, we just fill in that area. And we just, like suppose, even if you look at my face, you may think I'm for a 42-year-old, I may be looking young right now. But ideally, that's thank you for the compliment. But I am 42 because there's 16 years of experience as a dermatologist. So
that. I mean, we have the example right there, people. So if you're going through any of your skin problems, just go to Dr. Vimala. She's going to solve all your problems.
Yeah. So if you just look at me, you may think 42, I'm looking young for 42. But if I actually do a procedure and I actually pull up this area, so what happens? My tear trough disappears, my fold here, which is called the nasolabial fold, disappears. And then the jawline also, I pull up like this. So this is what I can do with a filler or a thread lift. And you can see this side and this side. This side definitely is 5 years younger than this side. You can agree with me. I look much younger. Now this could be a younger version of me if I get it done. But unfortunately, I have to go to some other dermatologist if I have to get it done. But you can always come to me. So that is what fillers and thread lifts do. And you do a single session, they last for a year. So since aging is a continuous process, obviously after a year you have to get it done again. But one sitting, single sitting, the result will last for a year.
So is there a particular age that,
That's what I said. Above 18, anybody can get it done if they have an indication. So if they have a deep nasolabial fold or if they have the tear trough, then some people use a lot of facial expressions with the people in the media or the actors. And so for them also, it's very important. They use all their muscles. And when you're using your muscles too much, definitely you will have faster wrinkling. Like people who smile a lot, they'll have their crow's feet. People who frown a lot and they're usually annoyed, they'll have these lines here on the forehead. And people who have this expression always, they'll have these forehead lines. So all this, when we are actually giving the expressions, you'll have this. But what happens once you start aging, even if you don't put any expression, the lines on the forehead or the lines near the eyes, which are called crow's feet, or the frown lines, they will appear even without putting any expression. So these are called static lines. So even before the static lines appear, we should start treating with Botox actually. So those are treated with fillers and there's volume loss which happens because as we keep aging, the fat near the cheek, the fat here, all starts descending. Because the gravity down. So when we are really young, near really good apple fat here, and it starts going down. And once the fat increases here, this is the fold which increases.
Okay.
So for that, we give fillers. For lines, as I said, when we are using expressions, we relax the muscles with Botox, botulinum, that is. So that relaxes the muscles. So it doesn't paralyze the muscles. It doesn't cause any side effects. There are a lot of misconceptions regarding these injections. But done by a trained, certified dermatologist, experienced dermatologist, hardly any side effects. And it's not even painful procedure. And single sitting, 6 months it will last, and every 6 months you get you come and get your Botox, botulinum toxin, botulinum injections, and your fillers once in a year.
Okay. But Dr. Vimala, also, a lot of people say that Botox is not fillers and fillers is not Botox. So when we say
both are completely different because Botox is something which we inject and it, for the time being, it just relaxes the muscles. Because when you're using certain kind of muscles, we are contracting. Okay, so when I'm closing my eyes tightly, I'm contracting the muscles of the eyes, and then the lines appear here. Okay, when I'm doing this, the forehead lines. So you're contracting that muscle and the lines are happening. And I'm trying to relax the muscle. So when I inject it and relax the muscles, even when I do this, the lines will not be so prominent. And an inexperienced person who does this, they give a very plastic look. So even if you want to try to put an expression, they can't. So they look more, there was a time when there was a big hype about these plastic faces or model looking like faces, because of too much of Botox and all. So you go to a trained dermatologist and a certified dermatologist who's experienced, they will never do such kind of job. So these are all done by untrained so-called aestheticians or beauticians or cosmetologists who are not actually done their medical education, whether it's regarding dermatology or whatever. So there are a lot of quacks there doing these procedures, and then people getting wrong things that these are dangerous or these have side effects.